Hi, Dr. Freeland. I'm Carly Green, and I am presenting to you today the Nuremberg Code, the clinical research, and the IRBs. So, what is the Nuremberg Code? It is a set of research of ethical principles that have been set for human experimentation. The background info. It's the most important document in the history of the medical ethics. It formulated in 1947 in Nuremberg, Germany. That's how it got its name. It serves as a blueprint for today's principles ensuring the rights of subjects in medical research. What did the system code come about? Well, it developed as an international code of ethics established after World War II for Nazi war criminals who stood trial. The Nazi doctors were accused of torturous or murderous human experimentation in concentration camps. It was adopted as a standard in the 1950s and 1960s for the protection of human subjects involved in clinical trials and research. As I said, it came as a result as the Nuremberg trials at the end of World War II at the concentration camps in Germany. Medical case, it was the USA versus Karl Brandert, which is the doctor's trial, in 1946 and 1947. It also was prosecuted, it prosecuted 23 doctors and administrators accused of organizing and participating in war crimes and crimes against humanity in form of medical experiments and medical procedures inflicted on prisoners and criminals. And civilians, So the views of society of the Nuremberg Code. Well, positive medical experiments on human beings all conform to the ethics of medical profession. But the negative, people say such experiments yield results for the good of the society and are unprocurable by other methods. But they all can collectively agree that the basic principles set by the Nuremberg Code satisfy the moral, ethical, and legal concepts. So, past cases and examples of the Nuremberg Code. So, prison experiments in December 1943 conducted to investigate effective of various poisons, including poisons in food and poison bullets. So, all these cases that I'm explaining are results of the Nuremberg trials, what they were doing to the people in the concentration camps, and just examples of clinical cases. So then they used phenol gas experiments, which investigated the relationships of phenol and gas to facilities among wounded soldiers. They used sterilization experiments, which conducted methods of rapid, large-scale sterilization in order to ensure elimination of enemy populations while keeping captive workers at labor force during the war. Continued, we have the mustard gas experiments, which are the gas experiments. They were conducted for the benefit of German armed forces to investigate treatment of injuries caused by the gas. They used sulfonamide experiments, which was for the benefit of the German armed forces to test the effectiveness of sulfonamide and other gases as treatments for infected wounds. And they used euthanasia, secret killing of aged, insane, incurably ill, deformed children, and others. And this began in the asylums in Germany and later in the camps in occupied territories. So like I said, all those were examples of what they did as a result of the Nuremberg trials, why the Nuremberg Code came about, because those were the very harsh trials that they would run on people. So today's relevance in medicine of the Nuremberg Code. So an example would be, as in the age we are with AIDS, human research ethics began to rise, not only to offer protection from research, but also to gain access to it. So the AIDS crisis turned the fact of becoming a research subject into kind of a privilege, as it carried hope for an early access to treatment. So ethics must now settle two antagonistic objectives. This is what they go through more today, the objectives that they try to overcome. One, protecting the research subjects from possible harm, and ensuring non-discriminatory access to research potential subjects. So those are just, like I said, the two things that they have to keep in mind today and today's prevalence in medicine. So here are the 10 principles of the Nuremberg Code. 1. Its voluntary consent of the human is absolutely necessary. The experiment must yield fruitful results for the good of society. It must be designed and based on animal experimentation first so that they can ensure that the results on the human will be nearly what they tested on the animal. 4th, the experimentation must be conducted to avoid all unnecessary physical and mental suffering or injury. The experimentation should not be conducted if there is no reason to believe it will result in disablement or death. The degree of risk must be accounted for and never exceeded the point at which the human life is going to be compromised. So 7 through 10. Proper preparation and facilities must be accounted for. Experimentation should only be conducted by scientific personnel, and they must be qualified. Human has the right to terminate the experiment at any point which they feel uncomfortable, and the scientist must be prepared to terminate at any point in the process where complications are shown to affect the human subject. So just a summary of the Nuremberg Code. It evoked a dark time for medicine, but it remains a powerful symbol and inspiring medical profession to stand up for Hippocratic values and protect individuals from harmful medical experiments. So now we will transition into what is clinical research. The branch of healthcare science determining safety and effectiveness of medications, devices, diagnostic products, and treatment programs intended for the human use. It's research that's conducted with voluntary human subjects or material from human subjects, such as like tissue, like things that they can donate, like specimens. Investigator must directly interact with the human subjects, and excluded from this definition is like vitro studies, which utilize human and tissues that cannot be linked to living things. So it must be linked to living things for clinical research. Okay, so there are 3 components. 1 is patient-oriented research, which involves a particular person or group of people uses materials from humans. The research can include mechanisms of human disease, therapeutic interventions, clinical trials, or the development of new technologies. So the second component is epidemiological and behavioral studies, which examine this distribution of disease, the factors that affect health, and how people make health-related decisions. And the third is the outcomes in health services research, which studies seek to identify most effective and most efficient interventions, treatments, and services. So what's the protocol? Well, it must be designed to safeguard participants' health and answers specific research questions described by the following. Who is eligible to participate in the trial? Details about the tests, procedures, medications, and diagnosis. The length of the study and what information will be gained and gathered. So what are clinical trials? Well, they are scientific studies that test the effectiveness of a treatment, device, or drug. They contribute to finding new and better ways of treating diseases. So there are different trials. There is natural history studies, which provide valuable information about new diseases and health progresses. There's prevention trials, which look for better ways to try and prevent disease in people who have never had the disease or prevent it from coming back again. There's screening trials, and this tests the best way to detect certain diseases or health conditions. There's also diagnostic trials, which determine the better tests or procedures for like certain specific diseases. There are treatment trials, which test new treatments, new combinations of drugs, or new approaches to surgery or radiation therapy. And then there's quality of life trials, which explore and measure ways to improve comfort and the quality of life for people with chronic illnesses. So there are 4 phases of the trial. Phase 1, researchers test the experiment, drug, or treatment in a small group of people. The purpose is to evaluate its safety and identify side effects. Second is experiment, drug, or treatment is administered to a larger group of people, so it determines the effectiveness and further its evaluative safety. The third is experimental drug or treatment administered to larger groups of people, 1 to 3,000. So it's just going level to level, like phase 1 through phase 4, you just get more and more people every time you go. It compares it with the standard or equivalent treatments, and it allows experiment or drug treatment to be used safely. In phase 4, is after the drug is approved by the FDA and made available to the public, researchers must continue to track its safety, seeking more information about the drug and the treatment risk, benefits, all that jazz, optimal use. So what are the benefits to the participants pertaining in the trials? Well, aggressive treatment, patients with advanced diseases will benefit from this. Clinical trials offer most aggressive options for treatment. So early access to the treatment. Agent is being tested in the clinical trial proves superior patients benefit by having received treatment they wouldn't have been able to receive otherwise. Close monitoring, so there's always going to be somebody who's monitoring you. Each trial will have a protocol, as I described, which will specify how patients are seen and given their medication, and they'll just be continuing to be monitored. There's advancing medicine, which participants are advancing the war of cancer and other diseases. The relevance today, trials testing effectiveness of blood pressure medication, trials testing a certain drug, so can it lower, some examples, can it lower cholesterol, does it act as an antidepressant, does it help with ADHD, will it control ADHD, does it act as a laxative? These are just examples that that clinical trials can be used to test. So, clinical nurses. Those are the specialists. They are advanced practice nurses who hold master's or doctoral degree in specialized area of nursing. The area of clinical expertise may be wide varying, so population, setting, disease, type of care, type of health program. They focus upon helping patients to prevent illness. The CNS practice includes diagnosis and treating of disease, injuries, or disability within the expertise field. They provide direct patient care, serve as an expert consultant, and take providing new health care into their hands. So what is an IRB? Lastly, it's an institutional review board. It's an independent committee consisting of physicians, statisticians, members of the community, and all assume clinical trials are ethical, that the rights of the participants are protected. Their mission is to facilitate objectives by renewing, approving, modifying, or disproving research protocols submitted by researchers. The process is based on rules, regulations for federally funded research. They strive to create a culture of respect and awareness, rights of the human welfare, research participants, while advancing knowledge and facilitating the highest quality of research. What is needed for the approval? All human subjects research must receive approval from the IRB. Therefore, if research meets the definitions, the IRB process must be completed. It is a lengthy amount of paperwork and qualifications. And here are my sources, my works cited, and then I have a reference page, APA format. What I will do is I will email my PowerPoint to you and my APA works cited page, and get my grade back then. Thanks for watching, Dr. Freeland. Have a good day.